and get that body moving. This morning we're heading to physical therapy.
Yeah, right now Julie live and local with head-to-toe physical therapy. Julie, good morning.
Did you guys know it was a full moon last night?
No. Uh-oh.
Yeah. Dr. Benji Toe and I were just talking about it because I was telling you how I woke up weird and you said, oh, it must be the full moon. And I was like, it all makes sense now. Yeah, we're at Head to Toe Physical Therapy. This is Dr. Benji Toe. We're talking about the benefits of physical therapy, what it is, and do you need it? Thanks for being here today.
You're
How
welcome.
are you?
I'm doing great.
Good. Okay, take us on a tour de France or tour de office, if you will.
Yes, of course. So this is where we enter the building. It says Community Dental Health on the front, but we're on the first floor, and this is just the waiting area where my patients come in and wait. And we're just right here to the right.
Oh, you got 5-star Google reviews.
Yes.
I just saw your book.
Yes, I like to leave that there for when people are sitting there waiting. They can read all my 5-star Google reviews. Just past 100.
Wait, you printed out your Google reviews?
Yes, I did.
I just saw this as we were meandering by. I thought that was funny.
I'm glad you highlighted that.
That was good. He's got a bunch of them there. It's a pretty good sized book. Okay, let's continue on. I'll follow you in.
We're right in here, so just this way.
Suite 8. Okay, this is the space.
This is the space. So, when patients come in, we always start right here. I just have a seat and chat with them, especially in the first visit. We have a lot to talk about, and so we go through their medical history.
What's the first question you ask somebody in physical therapy?
Why are you here? What are you looking for, kind of thing? Yeah, I always talk to people before they come in the office, so I have an idea. But once they come in, we start getting into the nitty-gritty of like, what's hurting, why is it hurting, and you know, what they're trying to work on. So yeah, we usually sit there and talk for a while, just to get acquainted, make sure I understand everything that's going on.
My backpack's over there, if you guys see that. That's not his mess, it's mine. So you have a pretty cool size space, and you said you just kind of moved into here, didn't you, recently?
Yep, in January.
Okay.
So. Was downtown before and moved here and have been loving the space. Yeah, it was just an expansion for me, and yeah, it's been going really well.
Can I ask you kind of an off the shoulder question? When you go through the doctor program, do you have to touch a real body? Like a dead one, a cadaver?
Oh yeah, of course.
Really? But that's not a real one.
Yeah, so that's Alfred. That's my friend Alfred. We go all the way back to physical therapy school. That's how I learned all the bones. But
that's it. Gives me the heebie-jeebies.
That Alfred is not real, by the way. Alfred is fake bones.
Good. His bones look very
anatomically accurate. Yeah, in school we had to cut lots of bodies. That was definitely part of it.
He can know your body very well and help you fix it, right?
Yes.
What's the fastest you got a patient to recover in?
I always like to set realistic expectations on a timeline. So most of the time it takes some time, like a few months, you know, because I want to help people get a long-term result. That's something I tell all my people. But sometimes it happens in one visit. They just have something kind of a little quirky thing going on, and they just need a little tune-up, a little bit of direction on how to manage it, and that's all they need. Consistency
is key, though.
That is correct. For the majority of people, like the nature of the work I do with physical therapy, it's like exercise-based, right? It's like, how can we teach your body to heal? And I'm going to teach you the tools and what you need to do, and that takes time. So we guide that process over several months.
Okay, Craig, Abby.
Yes. Yes. I want to teach my body to heal.
Well, that means you
Craig wants to teach his body to heal. What's your #1 tip to give to Craig to heal Craig's body? Craig's like 7'4", by the way.
For real?
Yeah.
No, I'm not.
7'4", he's close. He's close.
That's a tall glass of water.
Do you think he'd fit on this table?
No, he definitely wouldn't. I would need to get a bigger table for Craig. So.
Gotta get you a bigger table.
This is going wrong.
That's true. Yeah.
But yeah, this is the table where when we start doing like hands-on treatments, like I do some soft tissue work. I do dry needling, which we'll demonstrate later on some real life patients.
The soft
tissue. I'll go through some anatomy, explain to them like what's going on, what muscles might be involved with their injury.
You break them down. Okay, hey, we got all that coming up.
There's a lot to do.
Don't go away. We're gonna heal your body, Craig.
Tell him you're not 7'4". I think he thinks you're 7'4".
6'7", right? 6'7".
6'6".
Oh, you're shrinking.
Well, I used to be 6. No, I've always been 6'6". I think I might be shrinking though.
Did you tell people you used to be 6'7"?
No.
Oh.
Well, now there's a guy telling people you're 7'4". So that's your program weight, like when you were playing, or height when you were playing basketball. 7'4". All right, let's get
Julie live and local at Head to Toe Physical Therapy with the benefits. Good morning, Julie.
Do you guys know what dry needling is? Good morning to you, by the way. I wasn't trying to be rude. Have you heard of dry needling?
I'm very familiar.
It's like acupuncture, right? Kind of, sort of?
Kind of, sort of, yeah.
Is dry needling like acupuncture, Doc?
It's similar. It uses the same needles, it's different philosophy.
Different philosophy, okay. Abby, do you dry needle because of your knee?
Yes, ma'am.
Oh, wow.
Okay. Abby had a ski accident. Speaking of ski accidents, we were talking about that earlier, and her knee, now she does physical therapy, and she does.
Yeah, does some needling.
Is that the noise you make when you do dry needling?
Every time.
Okay.
If it doesn't work if you don't do that.
It doesn't work if you don't do that. Okay, we're at Head to Toe Physical Therapy this morning talking with Dr. Benji Toe about dry needling. We have a very excited guest here with us. Vida.
Yep.
We're dry needling. Walk us through what that is and let's get started. Let's see it in action.
Yeah, so dry needling is just a technique of using needles to target muscle tightness, pain, and inflammation. And so we've got Vida here we're going to demonstrate on. I have treated Vida before and done an assessment on her, and she's got some neck pain and headaches and things like that. So we're going to hit some of these muscles higher up in the neck here. So
Right, like kind of at the base of the skull?
Exactly. So there's a ton of muscle attachments that come up to the base of the skull and are frequently related to neck pain and headaches. And we're basically going to stick the needles in them and then attach some electrical stimulation.
Oh yeah, I've done acupuncture before with electrical stimulation. It's neat. It's neat how well it works.
Yeah, very, very similar. So we're going to hit both sides here.
We need a moment of silence here
Yeah,
on the golf course.
Then we can talk, but...
Is this something that a lot of people do, and how quickly can people see benefits from dry needling?
Yeah, it's fairly common. It's definitely becoming more popular, and it's something I utilize fairly frequently. You good, Vida? Mm-hmm. Okay. Yeah, but in terms of the benefits, sometimes there's relief right away, very, very often, if they come in with like active tightness and pain, like really in a lot of distress. Sometimes it'll be sore, and then it might feel better later on. The number of treatments definitely varies person to person.
What is dry needling like good for? Where in the body is it most beneficial?
So really, a lot. Like most places where there's muscles. So yeah, I mean the lower back, the spine, the shoulder, the knee, the foot. Believe it or not.
That's Doc. You just said and listed like the whole body.
Yeah.
Okay, come back out here to me in that double box. My producer's saying, "Wrap it up, kids." What's gonna happen next? What are we doing next?
In the next segment?
Yeah.
Oh, we're gonna go
Did
through.
I put you on the spot?
Yeah,
Okay.
we're gonna probably go through some squat exercises.
Oh,
Let's do that.
We're gonna get them booty gains,
Yeah.
Craig and Abby.
Now, is she
Build a
okay?
badonk, if you will.
What is her condition while she's having that done in her neck right there? Did you say that? I
almost
missed
through
that.
here.
Okay,
Of course, this
I'll
flew
ask.
by.
Okay,
Yeah.
Craig is curious about what Vita's condition is that this is beneficial for her.
Yes.
If you're okay
Are
sharing.
you okay, Vida?
Yeah, it's fine.
Okay, confirmed. We can share.
She was diagnosed with occipital neuralgia,
Oh, yes.
but like I said, associated neck pain, headaches, tightness in the muscles. So,
Wow, okay.
Yeah, that's what we're treating her for.
I got that, yep.
I'd say the most common thing that this is used for is like headaches and
Headaches,
neck
migraines.
pain. Yes.
Yeah,
yes.
That's
yes.
for us.
I might.
break it
You guys
down
are
for
being
us.
a pain in my neck. I might have to dry needle after this.
There you
A
go.
pain in the neck. That's
There you
what
go.
she's getting treated for. Huh.
Oh, physical therapy. Julie, good morning.
Do you like how the name is? It's TOH.
That's his name.
'Cause that's
Dr.
Doc's last
Toe.
name.
We should have went over that.
That
shouldn't
was
we have?
that was very clever. You want to talk about the name?
Yeah, we could touch on that.
Okay, tell me the T on the name.
Uh,
Little gossip this morning.
yeah.
It's not gossip.
Yeah, it's just my last name, and a friend of mine was like, "Hey, you should name your business." I stubbed my toe physical therapy as a joke when we were brainstorming.
Yeah.
I was like, "I think you're onto something," and then that kind of led me down this path. And yeah, it just kind of resonates with what I do. I treat the whole body, and I'm a believer in just treating it holistically. You know, looking at the big picture, not just lasering on one part of the body.
Okay, very fair.
Yeah,
Okay,
yeah.
what part of the body are we getting ready to physical therapy?
The lower back.
Oh,
so
good.
we're gonna do some deadlifts.
My
So-
back's been killing me from carrying this show. I'm kidding. Okay, deadlifts.
Yeah, so the deadlift is a great tool that I like to utilize with a lot of my patients with back pain, just to build strength in the back and build confidence with how to lift things. So you want to go through just a demonstration?
Yeah, let's do it.
All right, so first thing is you're going to stand real close to the bar
Okay.
with your feet about hip width apart.
Okay.
We want the bar right over the middle of your feet.
I wore my best shoes.
Yes,
Not
actually,
too close
those-
on the toes. The men folk write in weird things.
Those
Okay.
aren't too bad because they're flat, okay? So you're going to do what's called a hip hinge. So what that means is you're going to bend at the hips
Okay.
with your back relatively straight. Okay, yeah, you're doing great. And go ahead and grab the bar.
Okay.
Yep, right there. Oh, you went right for it, but that was not bad at all. That was not bad at all.
Give me the instructions.
Yeah, let's go to the setup. So
Okay.
hold the bar, don't lift yet. Yeah, lift your hips a little bit higher, right there.
Okay.
Okay, what you want to do is tighten your core like you're bracing for a little punch.
Okay.
Okay.
For a punch?
Yeah, like a punch to the gut.
You get into a lot of fights, Doc?
Well, I did used to box a little bit, actually.
what,
so,
really?
yeah.
Not me. I have a big mouth and I'll talk a big game, but if someone's like, let's fist fight, and I'll be like, Like, I run my mouth for somebody who's never been in a physical fight. Okay, so here I am.
Yeah, so you're bracing the core.
Okay.
You want to take the slack out of the bar. So that means to hold the bar.
Okay.
And I want you to pull, don't lift it, but just give a little tension and you'll hear it kind of click. Yeah, you feel that tension?
Yeah.
So you want to create a lot of tension, brace the core, and then stand straight up.
Oh,
Beautiful. You've done this
you think
before.
we can do a snatch? No, I'm kidding. How does this help the lower back?
Yeah, so we're literally just strengthening those muscles. That's a different exercise, but
I
that's
know.
okay.
I just had to get
Yeah,
right
just
in.
having fun. It strengthens those muscles in the lower back. It's obviously going to hit the glutes and the legs and everything.
Yeah, I felt it in my thighs.
Yeah,
well,
you
I
feel
did the
the thighs.
incline on Saturday.
Oh, nice.
I was really feeling it today.
Yeah, that makes sense. But yeah, it hits all of those things. But I think why I like to use this tool is because it just gives people confidence. A lot of times with back pain, people are afraid to bend over. They're afraid to lift things. And this is a really important tool. This might not be something we do day one with somebody who's has a hot bulging disc or anything like that, where they're in a lot of pain. But it's something we include as soon as possible, and to try to rebuild that strength and confidence.
And the the confidence. Of
totally.
Oh, I can do that.
Totally, and it works those muscles great, in the lower back. For the longest time, and I want to get into this later in a later segment.
Little tease.
Is the lower back exercise. So for the longest time, a lot of people think, oh, if I have back pain, I should strengthen my core, which is not a bad thing by any means, but it was so overplayed that people kind of shied away from strengthening the back. And so I'm big on no, we need to strengthen your actual back muscles.
Okay.
On the back side.
On the back side, we're strengthening
Let's not shy away from that.
Okay.
Can be really important for back pain.
It's coming up in the 7 o'clock
Yeah.
hour at Head to Toe Physical Therapy. I almost said physical fitness. Physical therapy this morning, Craig and Abby.
Muscles. This morning, we're going to physical therapy.
That's right. So right now, Julia's live at a local spot, head to toe here with the benefits here. And we're healing the mind and the body, Julia, all at the same time. Good morning.
Doc, do you heal the mind here?
Indirectly, yes.
He says indirectly, Craig and Abby, we can heal the
Okay.
mind, but definitely the body. Yeah, we're at Head to Toe Physical Therapy this morning, talking about the benefits of physical therapy, what it can do for you. In the 6 o'clock hour, we talked about dry needling of the neck. Now we're talking about dry needling of the shoulder. Right? What's going on right here?
Yeah, so we're needling Colleen's rotator cuff in the back of her shoulder. So we're on her shoulder blade. The rotator cuff is a commonly involved muscle with a lot of shoulder pain and injuries. And so we're targeting the muscles called infraspinatus and teres minor. Okay.
Learn to spell that on your spelling test,
a little
kids.
Latin.
Yeah.
And yeah, so we're doing 4 needles, two in each, and with some electrical stimulation. The goal of this treatment is to decrease muscle tightness, pain, and inflammation. It can be a powerful tool to help with people recovering from injuries.
What does the electrical stimulation do? Because I see that, we didn't quite see that part when it came to Veda. In the 6 o'clock hour, obviously now we see that it's hooked up into these needles now.
Yeah.
So what is that?
It's mostly to stimulate the needles. So one of the things that is a big part of the treatment is the blood flow response. So the needle itself is obviously causing a micro trauma, but the electrical stimulation is just further stimulating it. If we can maybe see it twitch here, you'll see the muscles just get a light twitch in them, and so that muscle contraction just enhances that blood flow response that can help with the benefits I mentioned.
What's the difference between dry needling and acupuncture?
Yeah, so it's mostly philosophy. Like I said, we use the same needles. To the untrained eye, it looks pretty similar, but the philosophy is different. Where acupuncture, again, I'm not an acupuncturist, so I can't speak to.
No, I saw you went to an actual institute for dry needling.
Yeah.
You have certification in this. You've
Correct.
studied it.
Correct, right. So yeah, it's just difference in philosophy, I would say mostly.
What is the philosophy of dry needling?
Yeah, so it's traditionally called trigger point dry needling. So it's primarily targeting those tight spots in the muscles to release that tension. But like I said, we've learned that it also has benefits from the blood flow response of decreasing inflammation through that blood flow response, and also can have a positive effect on pain. Neurologically, can kind of reset pain.
Okay, I thought I saw a twitch out of the corner of my eye, but it is
Yeah,
cool to
not
see the
yet,
muscles
not
start
yet.
to go
Let's
and
see
all
if we
that.
can get it twitching on camera.
Okay.
So here we go.
Okay, and you just moved into this location where you're at right now. You were downtown, now you're in business for yourself, so an opportunity to kind of be an entrepreneur at the same time while also being somebody who brings a little bit of pain relief. I know that Abby was talking about how she does dry needling. Of course, she goes to physical therapy for her knee because of that little incident on the slopes. Whoops. What's the most common injury that you see people come in here with seeking treatment for? Is there like a commonality, or is it a good variety of things?
I'd say I do see a pretty good variety, but my favorite area to treat is the lower back.
Yeah?
Lower back
Why
pain,
the lower
yeah.
back?
A lot of times it's involved with, just has a lot of factors that go on with it, like in terms of people's general health and well-being. And I like to help people not only rehab, from the muscle side of things and the joints and that kind of thing, but teaching them about their overall health and how they can take care of their bodies from a bigger perspective. And that's very relevant very often in lower back pain.
Okay, quite literally head to toe here at Head to Toe Physical Therapy. Craig and Abby, what questions you got? You got any questions?
Well, no, it's like jumper cables for the body.
It is a little
There you go. It's like jumping a battery.
Craig calls it jumper cables for the body.
Yeah. Yeah.
They feel good.
We're getting a little twitch in there.
Right?
if you
Little
wanna
pulse? Little pulse?
Yeah.
Oh,
wait,
We're
a
out of
twitch is
time.
happening.
We're getting
Is it
a little
working?
muscle
A little twitch is
yeah.
happening here.
Yeah,
Yeah,
so
it's working. See that
just a light
muscle twitch?
Can
Yep.
she feel the
Can you
difference?
see it, guys?
Can she feel this happening?
Oh, you can feel the twitch.
We won't ramp it up too
Can
much.
can she feel this? Can you feel this happening right now? Oh yeah. She said yes.
Oh, yeah.
She said yes. We got a head nod.
Yep.
Yeah.
Okay.
You're getting
Okay.
jumper cables.
Yes. You get Craig. We ordered you a table in here so you can have this done.
Oh, is it big enough for me? Thank you.
Yeah, it'll be here in 2 to 5 days. It's just got to be.
Okay.
There you go. Julie, thanks.
Thank you.
Have over super things. But wake up and get that body moving this morning. We're heading to physical therapy where we find Super Julie.
I bet Superman got physical therapy. I bet he needs that, right? If he has to have a dog, then he has to have physical therapy and robots.
Possibly.
He's not so super anymore, if you ask me.
Julie have
No,
to
he
say about
needs the
this?
no. He needs the yellow sun, Craig. He doesn't need physical therapy. He needs the
What?
light of the yellow sun.
Okay.
And when it comes to crypto, because
Yeah.
I saw it too. I have thoughts. Okay.
Did
I
you
don't know how
like
much
the
time
movie?
they're going to give me.
Okay, okay.
Well, here's the concern that I had with the movie. I was afraid there was going to be so many characters that already are kind of big within the DC realm that they wouldn't have character development. And I get that they're trying to rebuild the universe and everything like that, but they need to establish people.
Okay.
So I was in on it. However, when it comes to crypto and Supergirl and all that, 2026 is the year she's supposed to have a movie coming out. So don't. And also, for those of you who haven't seen it yet, stay through all the credits. There is
Talking to
something at the
Robert.
very end. So
Between you and Robert, you're saying, I don't know what's going on. You're
I
saying
can't hear Robert. Robert doesn't have a
know.
We need to
microphone
go
on.
see the movie.
Okay.
Okay. Tell
Julie.
us about where you're at.
Yes. Dr. Toe.
We're at Head to Toe Physical Therapy. Dr. Benji
Toe.
Toe is here with us. Have you seen
Yes.
Superman?
No, not the recent one.
No.
Unfortunately.
Oh.
I've seen other Supermans. There was a lot of.
Do you think Superman would come to physical therapy?
Well, of course not. He
It's a-
doesn't. He's, super.
Yeah, see, he knows. But us regular humans, we got to keep our body in shape.
Yeah.
We're talking about the benefits of a squat. Let's walk over here to your board because
Yeah.
you were getting ready to walk us through.
Yeah,
What's
yeah.
up here, Doc?
Yeah, just what I call a squat deadlift spectrum. So these are two movements I like to utilize in physical therapy a lot. And how I try to categorize it simply is that there's a spectrum of hip to knee, which muscles you're using. So both the squat and the deadlift are great for strengthening the hips and the knees, but there's a spectrum. So the deadlift is biased towards the hip, the squat is biased towards the knee. And for those workout geeks out there for me, there's different types of squats and deadlifts. The back squat is going to be more, I mixed it around.
Oh,
These
no.
two are switched.
Okay.
Yeah, well, look at me. Yeah, so those are switched. The back squat is more hip dominant. The front squat is more knee dominant.
Okay.
And then kind of same for the deadlift.
And why do
So
you want to do squats and deadlifts? What are those good for?
that's just great for strengthening the lower body muscles, and they're what's called compound movements. So they're very efficient because it works a lot of muscles at once.
Okay, what are we working out?
Yeah, so we'll get you inside the squat rack here.
I'm committing
and
my-
We'll just do a back squat.
There's a crime that I think is being committed, and it's that I'm working out in jeans.
That's true.
Yeah.
Well, I didn't give you warning, so that's fair.
Yeah. Sometimes I'll see the incline and people are in jeans and flip-flops, and I'm always like, oof.
Yeah, respect. I
My
guess,
thighs are
but-
rubbing for you, buddy. Okay, what are we doing here?
Let's go without the bar first. So
Okay.
let's go with a stick here. So I'll pass you that.
Okay.
Just on your shoulders. Yeah.
On my shoulders.
So let's go hip,
Okay.
feet about
Okay.
shoulder width apart. Yep. And let's see what your squat pattern is first. Just
It's right
to go.
here.
Yeah, nice. Just do what feels natural for you a few times.
Do you like that? Okay, here you go. You ready for a real one?
Okay. You
Okay,
wanna
I'll
go
have to send it
bar?
back to the
Okay,
studio. I'm ready.
Yeah.
My traps
It's
are
like,
ready
I might
to
as well get a
support
workout
this.
in, right?
I know.
Yeah.
How low do I go?
Nice. As low as you can.
Oh! There we go.
Nice. Yeah, so you're getting a more of a hip dominant squat, which is just going to
One
bias.
time I racked 220 in college.
Let's
It
go.
was on a machine though.
Nice. Hey, it's still great. Yeah, yeah. So I'm going to show you a front squat as a
Okay,
variety.
but then I have to wrap. After this front squat, we'll wrap. Let me see it. You
So-
do it.
Oh, me do
Yeah.
it. Okay.
You got the workout
So
pants
the front
on.
squat is a little bit more knee dominant. So when you have the bar in front, it allows you to keep your upper body more straight, and the knees come forward a lot more. So obviously that's a bit more intense than the knees, but again, it's just a spectrum. It's a dial that we can shift to say, okay, do we want to work the hip more? Do we want to work the knee more? Someone with a knee injury might not like a front squat, at least initially, but it's something they can work towards, and vice versa with a hip or the lower back. It's just a dial we can play with to get the right exercise prescription for that person.
To help them build up whatever they need built up. We're at Head to Toe Physical Therapy. Craig and Abby, you got any questions?
I'm here. I have a question. Is head to toe?
Yeah, Matt Meister's got a question.
Is it like, do they take insurance and stuff like other physical therapies, or is it like I just want to go to physical therapy and so I'm going to pay?
Matt has a question for you. He's our chief meteorologist. He wants to know, do you take insurance? Do people get referred to you? Like, what happens there?
Great question. Yeah, so I'm out of network with all insurances, and I do that intentionally to take out that third-party middleman so that I can work directly with my clients with exactly what they need without that oversight of a big insurance company telling me and my patient what they think we should be doing. And so that's the short of that. But how I get clients, mostly word of mouth, networking. I've done a lot of just networking in this community, getting to know people, and that's kind of just build that base.
Okay, so you said to insurance companies, not dealing with them.
Essentially, we're on TV, so I'll keep it professional. But
Julie, do you have a fetish with your feet going on
it
today?
gives me a lot more
Can we
freedom to
zoom in
spend more
on
time with
Julie's
my
feet?
patients.
on
Just do a
Julie's
better
feet?
job.
I
I just believe it's just a better
No, we're not zooming in on Julie's feet, Craig. We're not doing it. No. No,
Here we go.
I swear to there we go. We're keeping it on. The eyes are up here, buddy.
We want to see that footwork.
Could be a thing. All right, let's get outside this morning. Thanks, Julie. Thanks, Toe. We'll see a couple clouds right now, but they will build into some thunderstorms later on today.
Right now, Julie out there at Head to Toe Physical Therapy. Julie, I want to clarify to you too. So Katie sent this email in that Craig hates dogs. I don't hate dogs. We were talking about the need to have a dog in Superman. Crypto, which I thought was kind of a lame.
Crypto's a big part of Superman.
Oh, please. No, he's not. No, he's not.
Yeah, oh, who has the? Do you have a comic book
There has
collection?
not been mention of any crypto in any other Superman franchise or movie. And all of a sudden, they're throwing in crypto.
Yeah, oh,
No.
Craig, I'm going to tell you, you were wrong. You were wrong on this.
I'm staying out of this one.
You're wrong on this.
And the super robots? Give me a break, Julie. Give me a break. He's Superman. Does he need robots?
You're wrong on the crypto. You're wrong on crypto. But you know, he's had the robots. They were in the Ice Fortress in the Henry Cavill series, too. I think that they were in the... I can't quite remember. I'll have to double check. I feel like they were in Christopher Reeves as well, but I'll have to go back and do some double checking on that.
No, they weren't. I can tell they
However, when
weren't.
it comes to... They were 100% in the Henry Cavill
it's a
Superman
fight.
one.
It's a fight. You two want
Because
didn't
Lois
need
Lane
robots.
sees Superman. No, hold on. Lois Lane sees Superman go to the Ice Fortress, okay?
Yeah.
And she's like, "Ooh, I'm a journalist. Ooh, what's in
Right.
there?"
Sure.
And one of them attacks her, and he rips it apart, makes those noises exactly, and then he has to cauterize a wound with his laser vision on Lois Lane. I could go all
That's
day,
not the Christopher
and you don't
Reeve
want that.
version,
I don't know. Go, Julie. Tell us.
That's
about,
the Henry Cavill version.
though. Yes.
Tell us about physical therapy. I'm lost.
You know what I mean, Dr. Toe?
Totally.
Yeah, this guy knows. Am I right, or is Craig right?
You're right, of course.
See, and
Yeah.
he's a doctor, so he knows. Hey, we are at Head to Toe Physical Therapy this morning talking about how strengthening your body can lead to an overall better life. We've been talking about the back this hour, so walk us through some exercises that you do here with clients that kind of helps them not feel so cruddy.
Yeah, so this first one I want to show is a back extension. Now, most people are probably familiar with what's called a Roman chair or a back extension machine in the gym where you're doing it, but I'm going to use a demonstration here with the squat rack and the barbell to show where we just get a nice way to work the back extensor muscles like this, where you're hinged forward and you're coming up. Okay, to progress it, we can hold some weights like a plate or a dumbbell.
What
right?
kind of injury would that benefit? Like if you have a back injury, like what's that going to help?
Yeah, so a lower back injury, all varieties of lower back pain. very commonly when a person injures their back, they stop bending, they stop using their back muscles, and some studies have shown...
The bend and snap is out.
Yes.
That's a Legally Blonde joke.
We need to get the bend and snap back,
Yeah.
yes.
Yes.
Yeah, there's actually atrophy like in the muscles. We've seen those muscles actually like shrink in size in the lower back, and so working them can be really important to restore that function.
So it's almost like you get an injury, you stop strengthening the muscles, and then it kind of perpetuates the injury because it starts to atrophy.
That's exactly it. Yeah, you kind of avoid it and compensate. Now, sometimes, you know, that's why it's important to move like through injury and in the right amount, right? But if you let that go on for a long time, people get stuck in a chronic pain cycle where they're in this hole now where their back can't do anything, and the slightest things in their daily life takes it off. So it's really important to break through that and rebuild that strength and capacity.
So like
back.
don't wait if there's an injury. Like get to a professional and figure out how you can compensate or fix it.
Yes.
What's the next little?
Yeah, the next one is called a reverse plank.
Okay.
It's called a Chinese plank. I don't know why. I think it's weird, but I call it a reverse plank because you're just like upside down. Like most people know what a regular plank is, right? But we're this way. So a regular plank, when you're on your, facing down on your stomach, is working the front muscles. This one here is working kind of more the backside muscles, right? So we're getting the lower back, we're getting the glutes, right? And this is what's called an isometric. So meaning we're not working through motion, we're just holding a position. And sometimes it can be a nice one to do, especially early on, because a back can be sensitive to moving through motion like that one was. But when you just hold it still, you can put some weight in the lap. You get a nice contraction of all those muscles.
And you're getting that up like your muscles around your spine.
Exactly. You're just holding it. And you could do 10, 30-second holds, right, with varying amounts of weight. Obviously, we want to find for every person where can they start without it hurting, right?
A little bit of everything.
And build it up.
Okay, head to toe physical therapy. Dr. Toe here, Benji Toe. He is the guy that you'll be working with. It's his own space too, so it's like a one-on-one client situation if you're looking for physical therapy. I know sometimes you go into a physical therapy place and there's like one physical therapist per 3 patients, but not like that here, Craig and Abby.
By the way, Dr. Toe, very impressive with that reverse plank.
Craig's like, I've never even thought to do that.
Yeah, that was really talented. How he's
I'll let him know.
Like that.
I'll
Like
let
a
him know.
magic trick.
Please do.
Okay, thank you.
Very impressed.
Oh man, blew our mind today.
Okay,
So you want to try that and see how it feels?
you guys ready? I'm ready. Whee! Am I doing it right?
Yeah, so keep your hands on the floor. Roll forward a little bit. Yep. And then lift both feet. Yep.
Woo!
Squeeze. Yep.
Don't go to my butt. You guys are weird on the internet. Yeah, I get it. That's good.
Yeah.
I like that. So this is like a good way to just like, work
and then
out
you
the
can
back.
kind of lift up here as well if you want to get, kind of together so you feel that in the lower back muscles. And it'll get your glute butt muscles working as well. So
That's a good one. To like work out that lower back. You get a little crunch in there. Okay, you got a secondary machine.
Yeah, so this is called the reverse hyper, and this is just kind of the next step of it. It's a fairly unique machine, but it's one I like to use for someone who just needs a little bit more. So we can put some weights in it here.
Oh, so you get a little extra strong.
So where you're coming up like that, lifting through the legs, adding a little arch to the back end, so it's working those lower back muscles.
So it's a great way to kind of strengthen up your core type thing when you're having back issues. Type thing.
Core referring to the whole thing, but but specifically like the backside, your back extensor muscles is what we need to strengthen.
So
and,
some of these like positions you put people in to work out some of these muscles might look
weird,
a little silly.
Sure.
How do you build up the confidence inside of your patients to know like, no, this is beneficial in the long run?
The biggest thing is education. With every exercise, I always try to explain to a person, like, why are we doing this? What muscles are we working? What are we trying to accomplish? And the reality is, there's endless options for exercise. There's not one way to do it. It's just when you understand the principles and the biomechanics and what we're after, what are our goals, we tailor it that way. And so I just try to explain it that way, so it's not like, we're just pulling stuff out of thin air. Because there's other ones we can show you at some point, like a traditional back extension machine in the gym, where you're leaning over the pad and you're kind of doing that. It's a similar motion, right? And people are familiar with that, right? What's a normal exercise is just kind of what we're used to as a society, because those are the machines we have in the gym. But that doesn't mean that's the only way to do it. Yeah,
so you have a little bit of everything. Okay, do people just call you if they want a little physical therapy?
Yeah, pretty much, Or my website, they can submit a form and then I reach out. I always like to talk with them on the phone first for 10, 15 minutes, get oriented, see what they're looking for, and see if it's a good fit, see if I can help them out.
Okay, Craig and Abby.
There you go. Julie. Thank you, Julie. All right, got to work that core and that back.
The back. Don't forget the back.
Superman pose. All right, time now. It's 8:26. Well, President Trump announces new tariffs with trading partners.
Coming up, why he's